As we discussed, when you have narrowing of the vein and sometimes even of the artery, the flow will be disturbed. Either you won't have enough blood flow coming in, or you won't have the ability to have all the blood flow go back out towards the heart. In order to remedy this situation, we could use angioplasty. Angioplasty is a small balloon that we insert past the area of narrowing. The balloon will then be inflated. After the balloon is inflated for approximately 5 seconds or so, we take down the balloon, we deflate the balloon and remove the balloon, taking a picture and making sure that the vein is back to its original size. The narrowing that occurs in the fistula, in the venous part, is usually intimal hyperplasia, which is basically scar tissue building up. This whole situation, this whole creation of the fistula is very unnatural. We're asking the body to have our veins act as arteries, because now we have arterial flow going through the veins. The veins get irritated and try and scar down to protect itself. However, we want the veins to be wide open to allow the blood flow to get past. And so it's this battle between us and your veins to allow the veins to stay open and allow for adequate blood flow to get through so that your blood can get clean at dialysis. This angioplasty can and usually is enough to improve the blood flow past this area. Now, just because we do it once doesn't mean that you're done forever. In fact, scar tissue can very frequently return. For every patient, it's going to be a different amount of time. Some patients, it'll take 3 months. Some patients, it'll take 6 months. And some patients, they're lucky enough that it doesn't return at all. However, we have to make sure that these areas are open, and very often we have to check to make sure that the previous areas that were stenotic, that were narrowed at one time, are now open. This angioplasty balloon that we use to open up and expand the areas of stenosis, areas of narrowing, very often will be successful. However, if there's an area of elastic recoil lesion, imagine like elastic, you pull it, but then it comes back. Sometimes the intimal hyperplasia, the scar tissue, is so great that the forces keep pushing back into the vein and keep causing the vein to be narrowed. In those cases, we have to place what's called a stent. A stent, imagine, is like a spring, almost like the inside of a ballpoint pen. It's a curved spring made of nitinol that we are able to deploy at the area of narrowing. So if the forces are pushing against the vein and making the vein smaller, the stent can actually give structure to the vein and push those forces back, allowing for adequate flow back to the heart.